Skills Performance Checklist, Central Line Dressing Change.
Knock, knock. Hi, my name is Courtney. I'm going to be your student nurse today.
Check HCP orders and gather all necessary equipment, roll of tape, label, and central line kit, clean gloves, face masks, and disinfectant wipes. Identify patient with name and date of birth, and also check for allergies to latex or tape. Then explain the procedure to the client and or significant others.
Can you tell me your name and date of birth? Okay, very good, Miss Riley. And do you have any allergies to any medications? Any allergies to latex? Okay. Well, today we are going to be performing a central line dressing change. So I'm just going to kind of walk you through the procedure. If you have any questions as we go through it, you can feel free to ask. We're just going to be changing this dressing up here to the right upper chest, okay? I'm just going to get everything organized over here on the bedside table. Are you comfortable right now? Okay, we're going to lay you back just a little bit here in just a few minutes, but other than that, we'll just let you lay right there.
Wipe down bedside table with alcohol swab or disinfectant wipe while wearing gloves, then let dry. Remove gloves and wash hands. Place the client in supine position with head turned away from catheter insertion site to decrease potential for contamination by client's secretions. Then place a mask over the client's mouth and nose or a sterile drape over ventilated or trach clients.
Okay, Miss Riley, we're going to lay you back just a little bit more. Put you in a little bit lower position. All right, is that comfortable for you? And I'm just going to raise the bed up just a little bit from me. And I'm also going to put this bed rail down just so that I can get to the side a little bit easier, but I will be standing here the whole time. Okay, at this time I'm going to have you turn your head away from the dressing, and we're also going to put a mask on you. I will be wearing a mask as well because this is a sterile procedure.
Don mask. Organize supplies and equipment at bedside to decrease the amount of time that the site is open to air. Then don a pair of clean gloves. Remove present dressing carefully to minimize trauma and prevent accidental dislodgement of catheters. Discard soiled dressing in proper trash receptacle. Tip: when removing dressing, pull toward insertion site to prevent dislodgement. Then visually inspect the skin and catheter for signs of infection, leakage, or other mechanical problems.
Okay, Miss Riley, everything looks good. Now we're going to get to the sterile part.
Remove soiled gloves and open sterile central line kit. Don sterile gloves and prepare sterile field with supplies. Clean the area thoroughly with chlorhexidine using a back and forth scrubbing motion for at least 30 seconds, or follow institution-specific protocol. Then allow to fully dry. Tip: you may use sterile 2x2 gauze in the kit to lift catheter tubing when cleaning around insertion site. Remember, if you touch the catheter or the patient without gauze, your gloved hand becomes unsterile. After 30 seconds, apply BioPatch to insertion site. Apply an occlusive transparent dressing over the entire site. Do not use a 2x2 at the site. Label the dressing with date, time, and initials. Discard supplies used and wash your hands.
Okay, Miss Riley, we've got you all fixed up. I'm going to go ahead and take your mask off. You can just relax. Are you in a comfortable position?